Hi, I'm going to talk about the atrial fibrillation in patients with a cryptogenic stroke. Well, what is the atrial fibrillation? The atrial fibrillation or another name is flutter, is a common type of abnormal heartbeat. The heart, the the rhythm is fast and irregular in this condition, and arrhythmia is a problem with the speed or rhythms of the rhythm of the heartbeat. Atrial fibrillation is the most common type of arrhythmia. The cause is a disorder in the heart's electrical system. Well, often the people that present this disease might not even feel symptoms, but you can feel palpitations, shortness of breath, weakness or difficulty exercise, chest pain, dizziness of fainting, fatigue, and confusion.
A healthy heart works continuously to pump blood around the body by beating regularly under the control of electrical impulses that originate from the sinoatrial or SA node, the heart's natural pacemaker. These impulses radiate from the top to the bottom of the heart in a coordinated way. Each heartbeat consists of two stages where blood enters the atria, which subsequently contract, and forces blood into the ventricles. These in turn also contract, forcing blood out of the heart into the pulmonary and systemic circulations. In atrial fibrillation, electrical impulses do not originate in the sinoatrial or SA node, but from a different part of the atrium, or in the nearby pulmonary veins. These abnormal electrical signals become rapid and disorganized, radiating through the atrial walls in an uncoordinated manner. This can cause the walls of the atria to fibrillate or quiver rapidly, rather than contracting normally. Electrical signals are transmitted irregularly from the atria to the ventricles, which both fail to contract in a synchronized way. During atrial fibrillation, because the atria do not contract regularly, blood does not empty efficiently into the ventricles and begins to pool in the atria, especially in the atrial appendages. This pooling of blood can cause clots to form, which, if dislodged, can travel in the bloodstream towards the brain. The clot, or embolus, can potentially obstruct narrow blood vessels, often.
Okay, the common cause of atrial fibrillation include the alcohol use, coronary artery disease, heart attack or heart bypass surgery, heart failure or an enlarged heart valve disease, hypertension, medicines, and others. Well, here we can see the atrial fibrillation. In the electrocardiogram. Well, and another disease or situation is the cryptogenic strokes. A stroke which cannot be attributed to any specific cause after an extensive search for the most common cause, such as cardiac and other embolic large or small artery thrombi or arteriosclerosis.
About 30% of patients with stroke have something called cryptogenic strokes, meaning there's not a determined exact cause. We know that a small proportion of these patients with cryptogenic strokes probably have an undiagnosed irregular heart rhythm called atrial fibrillation, which can lead to clots forming in the heart, which can then travel to the brain and cause stroke. So my colleague, Dr. Kamel, and I, we performed a trial taking patients with cryptogenic stroke and randomizing half of them to prolonged cardiac monitoring, looking for atrial fibrillation, and the other half to standardized care. And what we found is that performing prolonged heart monitoring is safe, it is feasible, and it may be a very helpful tool in diagnosing the exact mechanism of stroke in patients with cryptogenic strokes.
Okay, and in the study, among patients with a recent cryptogenic stroke or TIA who were 55 years old or older, paroxysmal atrial fibrillation was common. Non-invasive ambulatory ECG, monitoring for a target of 30 days significantly improved the detection of the atrial fibrillation by a factor of more than 5 and nearly doubled the rate of anticoagulant treatment as compared with the standard practice of short duration ECG monitoring.